Hi, I am Andrea Arce, a medical student, and in this video, I will be performing LEOPOLD'S maneuvers. LEOPOLD'S maneuvers are 4 different palpation techniques that an examiner can use to help determine the positioning of the baby before a birth. First thing we need to take into consideration in doing this is to verify our patient with 2 identifiers, the name and the date of birth. Also, make sure that she'd emptied her bladder before the procedure. After confirming it with the patient, we can now explain to her how the procedures would go. And we have to explain to her that we will be placing our hands on her stomach to figure out the position of the baby. By this way, we will be sure of our patient's comfort. Once everything is cleared out and understood by the patient, make sure that we provide privacy for her and guide her to the right position in a flat or supine position with both legs flexed to the thighs and abdomen bared. Make sure that we drape the patient appropriately. And before starting, we also need to observe proper sanitation. Make sure that we have our mask and gloves on, and in case that we don't use one, we have to wash our hands properly. I think that's it. And we're all set to do the LEOPOLD'S maneuvers. Starting off with the first maneuver. We're going to be facing our patient's face and we're going to take our hands and make a little triangle. Try feeling the top of the fundus using our fingertips, feeling for either the baby's head or the baby's bottom. Generally, a head feels firm, hard, and round, and it moves independently of the body. And their little buttocks feels like tiny and soft and move with the body. On the first LEOPOLD'S maneuver, we basically ask the question, what part of the fetus occupies the fundus? We determine whether it's head or buttocks, so we check on what we feel first, and it helps in identifying the fetal lie or determining the situation of the infant, whether it's longitudinal, transverse, or oblique. It will identify the fetal pole in which the uterine fundus is located. And that's the first step. Moving on to the second maneuver. So in this procedure, we will be looking for the baby's back. We're gonna take our hands and put them on the sides. One hand here supporting and the other hand gently feeling the side, feeling for the back. Then again, to the opposite side, try feeling for the back. The back should feel firm and smooth, flat and long, while extremities, knees and elbows are numerous, small, irregular, and bent on the other side. Basically, on this second step, we ask the question, where is the fetal back? We try to determine the location of the back, what side it is on. This is important to know because this is where we are going to place the heart rate monitor on the baby's back. And on this side where the baby's back is, that's where we get the most accurate heart rate tracing. So that's step 2. The objective is to assess the relationship between the back of the fetus and the maternal flank. Now on to the third maneuver. We're gonna make an inverted triangle on one hand or like an L with our fingers, and we're gonna check down here near the symphysis pubis, and we're gonna see if we can lift the baby's head up. If we cannot, that means baby's engaged and is reported as cephalic ballotable. If we can kind of move it around or like our fingers meet in the middle or movable mass is felt, then the baby is not engaged, which is reported as cephalic non-ballotable. So in step 3, we ask how deep is the presenting part. We try to determine the part in the pelvic outlet whether the head is engaged or not. We basically check for fetal presentation, whether it is cephalic, pelvaneo or breech, or podalico, meaning feet first. On here, we can check for the presentation and height of presentation, whether free high up to the abdomen or the fetus has descended and is starting to engage and be ready for delivery. And in the fourth and final step of LEOPOLD'S maneuvers, we're going to actually change our position. So we're gonna be facing at our patient's feet. Then we'll take our hands and kind of go all the way back, exerting inward pressure, then slide caudal along axis of pelvic inlet. So you start from the bottom and just kind of feel up like this to verify the positioning of the baby. In this last step, we ask the question, what is the fetal attitude? Thus, where the hand rests first is the location of the cephalic prominence. The bra should be on the opposite side of the back. The pelvic group allows us to verify the degree of fit of the presentation of the fetus in the maternal pelvis. In other words, if the head is presenting first, will the head of the fetus fit through the mother's pelvis during delivery? So that's the fourth and final step. Now we can cover the patient up, let her relax, and after which we can get the heart monitor on her so we can listen to the baby's heart rate. The 4 steps in Leopold's maneuvers are fundamentally simple. It does not hurt the mother nor the baby. And it doesn't have to take long as we're doing the 4 steps in the correct order. And that's it for this video. I hope you guys learn and enjoy. Thanks for watching!